Hello, InstaFam. It is Dr. T here. Lovely to see you guys. Sorry about that. It is a crazy stormy night outside and I have just sat down after running around after everybody today. So I've just said to my youngest, no, not right now. I'm not doing meditation. I'm going to do something for myself. So I am coming here to say hi to you guys for a Wednesday night. How are you? Crazy? And once again, my dog has come into my office. I don't know what it is about Instagram lives. He just likes to play amok while I'm on here. I hope you're really well. I had a fantastic time today. I did a podcast with the amazing Isabella Gosling, who has Let's Talk, period. So I would strongly encourage you to go over and follow her on Instagram, Let's Talk, period. I think it's AU. And we had an amazing chat today all around PCOS. It was a really, really good chat, and she has advised me that will come out in September, so definitely go and have a listen to that podcast. But one question that she asked me today, and I thought it was a really good one, was, what's my one top tip for pelvic health? And you always want to make an impact. So I was racking my brains for, what do you think my top tip is? And I honestly think one of the best things that you can teach your daughters and know as a young woman is how to track your cycles. Because if you understand your menstrual cycle, you understand the symptoms that you might have, so premenstrual symptoms or symptoms during your period or symptoms of ovulation or strange symptoms that might happen like intermenstrual bleeding that perhaps wasn't there before. You have a great awareness of your reproductive health. And I think that is really important, because if you have a great awareness of your reproductive health, you can advocate for yourself. Because for such a long time, aspects of women's health have been minimalized. I have so many patients come into my office talking about how they've been told by other healthcare providers that their symptoms that they're experiencing are normal, when quite clearly they're not normal. Or if they are, then they're interrupting of their quality of life and need to be managed. So if there is one top tip that I can share, I think that is know your cycles, because if you do, you will know your reproductive health. So I'm hoping that will be a helpful tip for you guys today. So lovely to see you guys jumping on. Of course, it is Wednesday night Q&A. So if you guys have any questions about women's health, reproduction, fertility, male fertility, please don't hesitate to drop those questions into the chat box. Remember the rules, and the rules are you want to keep your questions nice and generic, because I'm going to give a generic answer. I don't need to hear your whole life story. Try and keep it short and sweet so that I'm not having to read too much, because I'm not very good at reading online. All right, let's see. Is there anything that has been dropped in there yet? That's also something else I want to say, that I am not here to diagnose your problems online. I have really strict rules about not entering into social media medicine. I think it's really dangerous. I think it's not fair to you as the patient, because I can't take a full history, do a full assessment or any investigations before offering medical advice. However, what this is an opportunity to empower you with information, to start you, to progress your curiosity and to give you a place to start from, so that you can then find the right avenue to get the answers that you need to manage your health. So I think that's really important whenever you are listening to anything on social media, is really considering that this is just an information gather. It is not to give you health advice necessarily that is a management of your condition. It is just an opportunity for you to start investigating. Okay, so here we've got some questions. Sturker. Hubby has CF, cystic fibrosis. Do you recommend going on Menavit for a certain period of time before sperm collection? Not necessarily. Just because a man has cystic fibrosis doesn't necessarily mean that he has poor sperm quality. And in fact, if he has cystic fibrosis and he's affected, then you might actually find that if he has something called Cartegna syndrome, you can get some obstruction, which means he may have azoospermia or not actually have sperm able to be easily collected. So a little bit difficult for me to answer that question because I don't know you, but do I recommend that all men who are going through fertility treatment go on a multivitamin? Not necessarily, but do I recommend them to optimize their fruit and veggie consumption and eat a predominantly Mediterranean style diet? Definitely, everybody should. But yeah, difficult for me to answer that because I really don't know your history. Any other questions? Brooke Holiday, can ovulating on, what's CD 11-12? Cycle day? I haven't heard that one before. I'm guessing cycle day 11-12 be a sign that ovulation is not happening as it should be. Well, cycles can vary normally from 21 days right through to 35 days, and that's considered normal. So if you have a 21-day cycle, you would be ovulating on about day 7. Because remember, that second half of the cycle, the post-ovulation phase, is always 14 days. So if someone has a 21-day cycle, they're going to be ovulating on day 7 and then 14 days in the luteal phase. If they have a 28-day cycle, they're going to be ovulating on day 13, 14. So the fact that you ovulate on day 11, 12 is not a sign that there is anything wrong. It just could be that you have a cycle that is on the shorter side. But the fact that you know, because you're monitoring, because you're using an ovulation testing kit, perhaps you're monitoring cervical mucus, that then enables you to track your cycle, which is fabulous. So, Brooke, you're normal. Well done. Nice question. Any other questions? Come on, that can't be all for today. Seriously, there's got to be more. JEP04, question 1. Oh, that means there must be more coming. Question 1, can high rise stim affect egg quality? Oh, gonal F600. Would I necessarily recommend that anyone gets gonal F600 international units? Probably not. High dose. Of course, I didn't get that. Yeah, high dose. Can high dose stim affect egg quality? Not really. Is high dose stim with 600 international units necessary? Not really. You would probably get the same effect, i.e. number of eggs collected, if you just used 300 or 450. Some people actually even advocate using lower doses, 150 to 200, and you might actually get the same number of eggs collected. So quality is not affected by the dose of gonal F, but probably more the clinical scenario that is being that is indicating the clinical scenario that you might have, say hyperstimulation, for example. Interesting question though. Any other questions? Any other questions? What you got to think about is gonal F, any recombinant FSH. All it is doing is stimulating the follicle receptors, the FSH receptors that are on the follicle. So the point of doing high dose is that you're just sort of saturating the receptors in the hope that that is going to stimulate that follicle to respond. So if you don't have a lot of follicles, perhaps you're not necessarily going to get a response above a certain amount. Excuse me, and we think that probably greater than 300 to 450 is not required. Oh, there must be more questions. There must be more. Let me see. Oh, Amelia Claire, lovely to have you on. Do you think that supplements make a difference to egg and sperm quality? Oh, that's a very big question. Do I think that they make a difference? Well, it depends on what sort of supplements you're talking about. If you're talking about vitamin and mineral supplements, probably not. I think if somebody has adopted a good diet, so if you've optimized, and I keep harking back to the Mediterranean diet because there is a lot of data around how big data sets suggest that those who adopt a Mediterranean style diet have high pregnancy rates, but it's kind of not well researched. There's no good randomized controlled trials in this nutritional research space, but there's certainly a lot of correlational evidence there. And it kind of just makes sense, doesn't it? That if you're optimizing the amount of fruits and vegetables and good fats and lean meats and complex grains, you're probably going to be healthier. But do I think that supplements, particularly whether they be a multivitamin and mineral supplement, do I necessarily think that they improve egg and sperm quality? I don't think so. I don't think we have any good quality evidence to say absolutely. Is there some evidence that utilizing a multivitamin in men who have evidence of a high amount of DNA fragmentation in their sperm, so oxidative stress, would benefit from taking a multivitamin? I guess biologically we think so because multivitamins often contain antioxidants, and antioxidants act against free radicals, which impact on oxidative stress within the sperm. The problem is we don't know the right combination to take. And that's the big problem, is what combination, amount, dosage of vitamin and mineral supplements to take to significantly improve sperm quality that then affects pregnancy outcome. Very difficult to measure. Is it harmless? Probably. So is it reasonable to take a multivitamin supplement? Probably yes. Sorry, these are really deflating answers tonight, aren't they? Sparkling 786, how long should you wait after a C-section to try for another IUI? Well, you'd probably need to speak to obstetricians about this, but it is my understanding that for a straightforward caesarean section where the scar integrity is good, it's ideal not to fall pregnant within a 12-month period of time. That is my understanding. Do I see patients who have perfectly good outcomes in their second pregnancy falling pregnant 6 months after a Caesar? Yes, of course. But as I understand it, it's ideal to wait for 12 months. And Winston is going crazy. He's having zoomies. Bikini Krill, very cool handle. Recent research published by, Sebastian Leathersich has me freaked out about air quality. This cycle I took to wearing a P2 mask when I was outdoors during high pollution, peak hour traffic. Am I bonkers? Well, not in this day and age. Many of us wear masks outside, so no one will think that you're bonkers, Bikini Krill. And Sebastian's research is certainly really interesting. What you've got to remember though, and Sebastian would say this, I know him very well, is it's kind of big data. So it is looking at environmental measures. So it's taking sort of air quality measures. He's also done some research looking at seasonal effects, and then looking at parameters within sort of fertility outcomes, and then putting those data sets together. So it's kind of correlational, not causality. And I think that's the important thing to consider in a lot of this big data research, is unless you are looking at sort of longitudinal cohorts and comparing perhaps longitudinal cohorts over time that have different exposures, or even seeing what the exposure is and then looking at the outcomes over time, it's very difficult to see causality. About 15 years ago now, one of the big things was endocrine disruptors, so plastics and plasticizers, which are kind of ubiquitously all about us. But I don't see that these things are being ejected out of our population. I think it's important to stop and think about all the different places that you're going to get exposed to air pollution, and within the realms of what you can do, reduce them. But there could be a whole heap of other things and other confounders that we haven't even thought about. But it certainly starts to raise the question, what is it in our environment that we can change and we can't change to improve our fertility? Are you bonkers? No. Are you thoughtful and aware? Absolutely. And I think in this day and age, it's perfectly safe. It's perfectly fine to wear a mask. Can you respond differently to different types of FSH? Thoughts on human growth hormone for egg quality and quantity? Poor responder here. Oh, yes. Yes, it is a very challenging space. Do I think you can respond differently to different types of FSH? Yes, I do. I definitely do. And there is evidence to show that there are differences depending on the different types of drugs that are out there. So I would strongly encourage you to chat to your fertility specialist about the different options that you could try. Thoughts on human growth hormone for egg quality and quantity? Well, it is considered to be an adjuvant, something that you could consider using. And there is evidence to support its use in poor responders. And there's also evidence to say that it doesn't make any difference. Human growth hormone is an expensive drug. And I think, again, it is something that you would want to talk to your fertility specialist and understand in your particular situation whether or not it would be something that would be worthwhile and what are the potential outcomes that you might get. But unfortunately, the jury's really out. I don't think we can say categorically that it doesn't work. There are some pretty big, well-done studies now in multiple sites and centres that do suggest that it probably doesn't work, but equally there are smaller studies and quite a few of them that suggest that it does. So again, you need to sit with your fertility specialist and weigh up the pros and cons for you. Poozapant, that's another great handle. We're on a roll now, guys. Women with low ovarian reserve, what hormone stimulation is proven effective? Effective for what? Effective for what? Effective for getting you some eggs collected? Effective for getting you to an embryo? Or effective for getting you to a pregnancy? So I think we've got to consider what outcome are you actually wanting to achieve. They're all effective. So it's difficult for me to say because I don't really know what question you're asking about hormone stimulation. Anything that hyperstimulates the ovary that helps to recruit follicles is going to be effective. What you got to understand if you've got a low egg reserve is that you're never going to get very many. So it's always about the proportionate number of eggs that you're going to collect that then become embryos that you can transfer. And more often than not, in those people who are poor responders, you're going to have to do this more than once because, as we know, from the number of eggs collected down to embryos being created, there is always an attrition. So, yeah, it's a difficult space, but anything will work. And often this is a process of trial and error and see what works for you. Carly, Sarah, okay. If an FET fails after Zoladex suppression for endo, can you go straight into another FET or do you need to do another anti-suppression? My suggestion is go straight into another FET before you have cycles. Like you want to get these FETs before that endo or adeno grows back. Whew, guys, this is going to be my last one for tonight because I do know my dog is now eating something on my carpet and I don't know what that is. Melissa, Ngoni 1, if my left ovary is stuck on my bowels, is there a way to retrieve the eggs, or would I have to rely on the right ovary that is free? Depends on if you can access it vaginally. That's the long and the short of it. If your fertility specialist has done a transvaginal scan and the scan has said unable to access that ovary, it may be something that you need to have freed up before you have IVF. But I would absolutely, as I have always said throughout these live Q&As, you must talk to your fertility specialist, because I don't know your full medical history. So, but certainly have a chat with your fertility doctor to see if that ovary can be accessed. Right, guys, calling time out for tonight. Need to go and rescue whatever that is in my dog's mouth. Thank you so much for these fantastic questions. I've actually had to think quite a bit about them tonight, so thank you. And there's a few things that I might actually go and do some reading around to make sure that I get it right next time. Have a fantastic night. I will see you next week. Bye-bye.